What the study says.
Imagine this. A tiny cut, maybe a small puncture wound.
Mm-hmm.
Seems like nothing, right? But what if that tiny break in the skin is on your neck? What you see on the outside might look minor, but it could be hiding something, well, frankly terrifying inside. A hidden danger we're only really starting to grasp thanks to research. Welcome back to What the Study Says. I'm Dr. Kai.
And I'm Dr. May.
Today we're doing a deep dive into an area where appearances can be incredibly deceiving: penetrating neck injuries. PNIs for short.
Yeah, and we're not just talking about any scratch.
No.
A PNI specifically means an injury from something sharp, could be anything, a bullet fragment, even glass that actually goes through a key muscle just under the skin there. It's called the platysma.
Right, that thin sheet of muscle.
Exactly. And what's really quite striking when you look into the studies is just how much vital anatomy is packed into that small space.
Like rush hour traffic in there.
Totally. You've got your airway, your windpipe, major blood vessels going to the brain, critical nerves, all crammed together.
So any penetration, even one that looks small on the surface,
can be potentially life-threatening. And the really insidious part, the immediate danger often isn't obvious at all, which is why the research we've been digging into is so important.
Okay, so understanding the causes seems key. The sources we looked at suggest not all penetrating objects are the same, right? What's the difference between, say, a low-velocity versus a high-velocity injury and this cavitation idea?
That's a really great point. The studies definitely differentiate. So a low-velocity injury, like maybe a stab wound from a knife, might cause damage mostly along its direct path.
Okay.
But a high-velocity projectile, like a bullet, does something else. It creates this temporary cavity. Think of it like a pressure wave expanding outwards as the bullet passes through.
Ah, like a mini explosion almost.
Sort of, yeah. It creates this empty space much larger than the bullet itself for a split second, causing damage way beyond the track you can see. That's cavitation.
Which makes figuring out the extent of the damage much harder, I imagine.
Incredibly tricky. And clinicians often try to manage this by thinking about zones of the neck. Zone 1 is down low, near the collarbones.
Right.
Zone 2 is the middle part, and Zone 3 is up high, near the jawline.
And one of the really counterintuitive things we found in the sources, Zone I injuries, the ones lowest down, closest to the chest, they actually have the highest mortality rates.
Yeah.
You'd almost think higher up would be worse.
You would think that. But the research suggests it's because they're so close to the really big vessels coming off the heart and the main airways deep in the chest. The damage can be massive and harder to get to, harder to even assess quickly.
Makes sense.
And unfortunately, the carotid artery, that's the most commonly hit major structure overall. Big deal.
So what does this mean for, someone listening if someone they see gets an injury like this?
Well, the research is unanimous. If that platysma muscle is violated, it's a PNI, and that needs immediate professional medical help, no question. The sources talk about looking for hard signs and soft signs. Hard signs are the obvious emergencies, uncontrolled bleeding, spurting blood, or massive hemoptysis, that's basically blood frothing or bubbling from the wound, often means the airways hit.
Those sound like straight to the operating room signs.
Absolutely. Don't pass go. Don't collect $200. Straight to surgery.
Got it. So what about the soft signs? These sound sneakier.
They really can be. Much more subtle. Things like maybe some minor bleeding that stops easily, a hematoma, like a bruise under the skin that isn't getting bigger,
right.
Or even just a hoarse voice, maybe some pain or difficulty swallowing. These are clues, but not slam dunks.
So for the medics arriving first on scene, what's the protocol?
Priority 1 is get the patient to a trauma center fast. And here's a really crucial point the studies emphasize. If there's an object still impaled in the neck, leave it there. Do not pull it out in the field.
Oh, really? Isn't the instinct to remove it?
Totally.
Yeah.
But that object might be acting like a plug. It could be the only thing stopping a massive fatal hemorrhage. Taking it out could be catastrophic. Think of it like pulling the cork out of a dam.
Wow. Okay, that makes a disturbing amount of sense. What about managing the airway then? That sounds tricky too.
It is incredibly tricky. Some standard techniques, like using a bag mask to help someone breathe, if there's an airway injury, that can actually force air into the surrounding tissues.
Making things worse.
Yeah, distorting everything, making it harder to intubate later. Also, interestingly, routine spinal immobilization, neck collars and backboards, isn't always recommended unless there's a clear sign of nerve damage.
Why is that?
It can sometimes get in the way of quickly securing the airway, which might be the more immediate life threat. It's a balancing act.
Okay, so they get the patient to the hospital. What happens next? How do they figure out what's actually damaged inside?
Diagnosis often involves advanced imaging, MDCTA is common. That's a type of CT scan with contrast dye that gives really detailed pictures of the blood vessels. Super useful for finding bleeds.
But not perfect.
Not perfect. A major pitfall highlighted in the studies is esophageal injuries, injuries to the swallowing tube. They're notoriously hard to spot, even on good scans.
And dangerous if missed.
Very dangerous. They're a leading cause of delayed death because infection can set in. Symptoms might not show up for days, maybe difficulty swallowing, pain, or even blood in the saliva. It's like a slow leak that suddenly becomes a big problem.
A silent threat.
Exactly.
Yeah.
That's why surgical consultation is pretty much standard for all true PNIs once you're in the hospital.
And treatment, besides potentially surgery.
Well, any easily reachable foreign bodies get removed, obviously. If there's dead tissue or signs of infection deep down, they'll surgically clean it out, debridement and drainage. Antibiotics are usually given.
Tailored to the injury.
Yeah, tailored to what kind of object caused the wound and what bacteria might be involved. Like, the sources mention if it was a rusty nail, you might worry about specific bugs like Pseudomonas.
Right, and tetanus shots too, I assume.
Oh, absolutely. Tetanus status is always checked and updated if needed. For prevention, there isn't strong evidence for routine antibiotics for all simple puncture wounds, but it's often considered for high-risk people, maybe diabetics, or if the wound is really dirty. Close follow-up is key.
So wrapping this up, the biggest takeaway for you listening has to be that penetrating neck injuries, even the ones that look really small or insignificant,
Can be incredibly dangerous.
absolutely. Don't judge a book by its cover, or rather a neck wound by its surface appearance. Immediate medical evaluation by professionals is essential.
And remember those delayed symptoms, especially with the esophagus? They can creep up later and be life-threatening if ignored. Vigilance is crucial. And you know, what's really kind of amazing when you step back is how far we've come. Modern medical imaging, ongoing research, like the kinds of studies we discussed today, they're constantly refining how we handle these emergencies.
Uncovering those hidden dangers.
Exactly, giving us that clearer picture of what's really happening inside, which ultimately saves lives that might have been lost in the past. It's quite something.
It really is. We hope this deep dive gave you some crucial insights, maybe even potentially life-saving ones. Stay safe out there and stay informed.
And please make sure you subscribe and share our channel, What the Study Says. It helps more people get informed and stay healthy.